In this video, you will understand what is syncope, what are the causes of syncope, the cardiac causes in particular, treatment of syncope. Syncope is another word for fainting or passing out. Someone is considered to have syncope if they become unconscious and go limp, then soon recover. For most people, syncope occurs once in a great while, if ever, and is not a serious sign of illness. However, in others, syncope can be the first and only warning sign prior to an episode of sudden cardiac death. Syncope can lead to serious injury. Talk to your physician if syncope happens more often. Pre-syncope is a feeling that you're about to faint. Someone with pre-syncope may be lightheaded or nauseated, have a visual grey out or trouble hearing, have palpitations or feel weak or suddenly sweaty. When discussing syncope with your doctor, you should note episodes of pre-syncope as well. What causes syncope? Syncope occurs when there is not enough blood flow to the brain. Syncope is classified as neurally mediated, cardiac, orthostatic, or neurologic. Cardiac syncope, causes related with heart. The serious cardiovascular conditions are arrhythmia or abnormal heart rhythm. During episodes of heart arrhythmia, the heart works inefficiently and not enough oxygenated blood can circulate to the brain. There are many types of cardiac arrhythmias that may cause syncope. These include bradyarrhythmias and tachyarrhythmias. A tear in the large artery that carries blood from the heart to the rest of the body. This is a very rare but life-threatening condition. Aortic valve stenosis, a narrowing of the valve between the heart and the aorta. Aortic valve stenosis can be congenital or can be developed in old age. However, there are a variety of causes that can trigger syncope apart from cardiac syncope. Reflex syncope is the result of a reflex response to some trigger in which the heart slows or blood vessels dilate or widen. This causes blood pressure to drop, so less blood flow to the brain and fainting or near fainting or pre-syncope occurs. Reflex syncope is the most frequent cause of fainting. Few common forms of reflex syncope are vasovagal syncope, situational syncope, carotid sinus syncope. Orthostatic hypotension, meaning low blood pressure while standing, can cause fainting because blood has trouble going against gravity to reach the brain. Orthostatic hypotension is defined as a fall in systolic blood pressure of 20 mm of mercury or more on standing, resulting in syncope or pre-syncope. Postural orthostatic tachycardia syndrome or POTS is a rare clinical syndrome characterized by an increase in heart rate of at least 30 beats per minute on standing and orthostatic intolerance when standing brings on symptoms such as palpitations, lightheadedness, and fatigue. POTS generally appears in young women. It's important to identify the cause of syncope if possible to rule out a dangerous heart condition. Depending on your symptoms and circumstances, some tests may be used to find the cause. ECG, exercise stress test, echocardiogram or transesophageal echo, physical examination, tilt table test to measure heart rate and blood pressure in response to upright tilt, which stimulates prolonged standing. EP or electrophysiology study, a test that examines the heart's electrical activity from the inside. It is used to diagnose many heart rhythm disorders. The treatment for syncope will depend upon the underlying condition but may include catheter ablation, procedure to cauterize the specific heart cells that cause abnormal heart rhythms, pacemakers, device inserted under the skin below the collarbone to deliver regular electrical pulses through thin, highly durable wires attached to the heart, used to treat bradycardia, heart block, and some types of heart failure. Implantable cardioverter defibrillator, a small implanted device that delivers an electrical pulse to the heart to reset a dangerously irregular heartbeat, often used to treat ventricular tachycardia or heart failure. Someone is considered to have syncope if they become unconscious and go limp, then soon recover. For most people, syncope occurs once in a great while, if ever, and is not a serious sign of illness. However, in others, syncope can be the first and only warning sign prior to an episode of sudden cardiac death. Syncope can lead to serious injury. Talk to your physician if syncope happens more often.